Hello, I am Monica Baluyat of PSN3C of Group 9. And today I will perform a seizure, precaution, and seizure management. First of all, we have to review the medical record and nursing plan of care for conditions that would place the patient at risk for seizures. Review the medical records and orders and the nursing plan of care for orders for seizure precautions. For seizure precautions, gather the necessary supplies and bring to the bedside stand or over bed table. Perform hand hygiene and put on PPE if indicated. Identify the patient. Close curtains around bed and close the door to the room if possible. Explain what you're going to do and why you are going to do it to the patient. Place the bed in the lowest position with 2 to 3 side rails elevated and apply padding to side rails. Attach oxygen apparatus to oxygen access and the wall at the head of the bed. Place nasal cannula or mask equipment in a location where it is easily reached if needed. Attach suction apparatus to vacuum access in the wall at the head of the bed. Place suction catheter, oral airway, and resuscitation bag in a location where they are easily reached if needed. Remove PPE if used, then perform hand hygiene. For seizure management, for patients with known seizures, be alert for the occurrence of an aura if known. If the patient reports experiencing an aura, have the patient lie down. Once a seizure begins, close curtain around bed and close the door to the room if possible. If the patient is seated, ease the patient to the floor. Remove patient's eyeglasses, loosen any constricting clothing, place something flat and soft such as folded blanket under the head. Push aside furniture or other objects in the area. If the patient is in bed, remove the pillow and raise side rails. Do not restrain patient. Guide movements if necessary. Do not try to insert anything in the patient's mouth or open jaws. If possible, place patient on the side with the head flexed forward, head of bed elevated 30 degrees. Begin administration of oxygen based on the facility policy and clear airway using suction as appropriate. Provide supervision throughout the seizure and maintain intravenous access as necessary. Administered medication as appropriate based on medical order and facility policy. After the seizure, place the patient in a side-lying position. Clear airway using suction as appropriate. Monitor vital signs, oxygen saturation, and capillary glucose as appropriate. Allow the patient to sleep after the seizure. On awakening, orient and reassure the patient. And after that, remove PPE if used and perform hand hygiene.
Pre, apak, mga bobo kayo, second hard point. Ano ba yan? Ano naman, bilis!
Uy, Carl, ano ba yung ginagawa mo dyan?
Lalaro pa ako. First hard point.
Kay mama dun sa
Wet.
kusina.
Mamaya na. Lalaro pa ako, busy pa nga. Ano ba yan? Diyan, pre.
Siguro ka busy dyan. Uy, Carl!